This is a project that actually started at least a couple of years ago. The National Assembly realized, as did many veterinarians around all of our states, realized that there was a need to try to harmonize the health certificates. I have a little difficulty taking off my state veterinarian hat to go back to my practitioner days. I did that for 27 years, but I've been doing the other for 11. So, but obviously there is a need, and one thing that maybe Keith alluded to but didn't bring out particularly is when we're looking at health certificates in state veterinarians' offices, whether it's the state veterinarian himself that does it, and a lot of times we do have to review them, or our staff is looking at them, we get 50 different states' individual certificates. And even though there are similarities, the formats are for the most part somewhat different. And so you're looking for one data field, one bit of information, and it takes a while to find it on certificates. Having a uniform certificate, we hope, will make some difference in that. At any rate, as I said, the effort wasn't my effort per se. It was an effort by the Assembly, and all of the state veterinarians provided information, and my secretary basically collated all of it and got it into, try to get it into one format that everybody could agree on. Last year at USHA at the National Assembly meeting, in principle, the Assembly agreed on the data fields and the format. So basically, it started out to unify the paper copies that were being used, but it has gravitated now to develop into hopefully a uniform electronic format and a certificate that can be used that way. And this is just an example of a current handwritten certificate. May be a little difficult for people to see, but I'm up here close, and in a lot of cases it's very difficult to read the writing. I happen to know who this veterinarian is that signed it here, but if you didn't know, it might be a little hard to read Warren Crawford's name. And that's one of the better legibility signatures. So legibility certainly is one of the factors. This is an example of the new electronic CVI, and we've had numerous people, numerous companies, as well as APHIS has taken what the Assembly developed and is turning it into probably several different versions of an electronic certificate. But so again, this is just an example. But what are the benefits? And again, I'll try not to duplicate too much of what Keith said because I agreed with everything that he did say. But obviously the benefits are going to be legibility, accuracy, consistency, uniformity. Retrievability is one that I didn't put up here, but I should have. Speed of commerce, and I think this will be very apparent when the veterinarian from the market talks about this, but the speed of commerce at markets is critical. And actually, when a veterinarian that's in practice goes out even to the country to issue a health certificate, as more and more states and perhaps APHIS begins to require recording of official ID on health certificates, having the ability to do data collection electronically is going to speed up the issuance of a health certificate even in the field. And I think back to when I was practicing, and I've written, I don't have a clue how many certificates in 37 years of being a veterinarian, but several thousand of them. And in the olden days, we'd go out, drive through or walk through a group of cattle, get a good look at them, write out a health certificate, get your permit, all of the stuff that the state of destination wanted, and go along your way. And it might take you an hour or two, depending on where the cattle were and how many there were. When all of this information on official ID is required in the future to be recorded on certificates by states or by the federal government, that 2-hour issuance of a health certificate on 300 head of heifers going to Nebraska is going to change. It's going to be a whole different ball game. So I think it's important for practitioners to have access to this type of a thing. So ease of completing information fields on the CVI is going to be an important thing. Real-time certificate submission and receiving. I would say that with qualification, because the reality is that depending on how these are done and what systems are used, it may not actually be real-time, but it would be very close to it. In some cases, a certificate might be completed, or the information at least gathered in the field, and then taken back to a veterinarian's clinic to go ahead and complete the certificate and send it on an email, or however it would be electronically transmitted to whatever entity is going to harbor the data and pass it on. And I've already talked about the individual ID, but a benefit is going to be immediate search lookup on all fields of data, including partial fields. So, in other words, if all you've got is a part number of a tag, for whatever reason, 83 AJK12 was all that got recorded, it'll still be looked up, have the capability to look it up instead of having the entire number. And then auto forwarding to the destination states. And again, this would depend on what entity is used to store the information and help get it delivered. What are the challenges and the requirements and the goals of this? Probably the biggest challenge, and again, this is one that I didn't think of until I was sitting here this morning to figure out what is it that I've already missed, and I'm sure there are plenty of things. But one of the biggest goals is going to be to get veterinary practitioner acceptance and use of an electronic certificate. People with hair the color of mine, by and large, in practice, are afraid of computers, and I'll admit that I was too. Before I took the job as state veterinarian, we had one at the clinic. I didn't ever touch it. Never touched it. Didn't even know how to turn it on. And I'm quite certain that there are a lot of practitioners that are the same way. I don't know if I was scared of it. I just didn't have any use for it. It didn't have 4 legs, and I didn't need it. We needed it for the business part. I had no business touching it. So that's going to be one of the very biggest challenges, I think, is getting veterinarians to use it. Younger veterinarians that grew up in the electronic age, yep, probably not going to be any problem. In fact, they probably could be the ones up here giving this talk. But the older ones are going to be a challenge. Another thing is going to be transitioning, and I don't have this up here either, but transitioning from the current in-use paper system that the states already have. And I can use Wyoming as an example. We probably within the last year ordered probably $20,000 worth of our current health certificate books. We're not going to just throw those in the garbage. We're not just going to shred those. So every state is probably going to use up what they already have, which is in their own current in-use format. And the other part of it is, even when we transition to an electronic, there still will be a number of veterinarians that are going to prefer to use the paper. So we're going to have to continue a system over time and transition, probably more by attrition than anything else, of the older generation into the use of the electronic CVI. But some of the data capture systems that are available now, and I'm not here to do any kind of a commercial, but there are several, maybe that's not even accurate, there are some companies that are already geared up and, in fact, doing a lot of projects in numerous states that are already taking care of some of the things that we need. So data capture in the country, there are already entities that can do an electronic CVI, have been in fact for a number of years, getting all of those to come together. And then I think probably one of the challenges too will be the federal government accepting and helping us to get all of this stuff integrated into a system that can work for everybody, so the data can be accepted, it can be integrated, it can be retrieved. User education, and this just goes back to the complications that we're going to have with veterinarians, but practitioners are going to have to be educated on the use of an eCVI. And I think that the livestock industry as a whole, and not just livestock, but even the small animal veterinarians over time will be using this. So I think getting the industry, the animal industry, to accept and embrace and understand this is going to be, maybe that's not so much a challenge as it will be just one of the things that we're going to have to accomplish. Connectivity. And again, there's a couple of different ways of looking at this. Depending on the system that might be used, some of these systems, if a veterinarian is expected to have a computer with him when he goes out to a remote ranch or farm to put this data all into the computer on site, having connectivity to an internet for a web-based type of a thing is going to be a challenge. On the other hand, if the veterinarian can go to the field, collect the data into something, and then get it back to the clinic where they can then put it into a computerized system and an email or whatever transfer media there's going to be, then I think we're going to have a pretty good way of doing things. And again, that goes back to the real-time delivery. It may not be right on real-time, but it'll be awful close. And then again, we've got to have easy interaction with state and federal systems. So why is practical application necessary? Well, I'm a living example of why practical application is necessary. Probably the reason I was asked to talk about this is they probably looked at me and they thought, now if this guy can understand an eCVI, damn near anybody ought to be able to do this. And I mean that sincerely, because I am no electronic whiz at all. In fact, I'm maybe as close to illiterate when it comes to electronics as anybody in this room. I'd bet on that. But I also definitely see the need for doing this for the veterinary industry, for regulators, and for the industry. So it has to be cost effective and affordable. And Keith kind of brought this up. Who's going to pay for this? Should this be an expense to the industry? Should it be an expense to the veterinary profession? Should it be an expense to the states? Or should it be an expense to the federal government? Probably the answer lies in all of those in some way, shape, or form. But the bottom line is we can't expect the companies who have spent lots of time and dollars to develop programs that can be used for this to do it for their health. I mean, otherwise they'd be out with their grandson fishing. So I think we've got to look at that and try to come to some kind of a resolution on how can this thing be financed, but then brought into a system that can be usable by the industry and by veterinary regulators, because the states need this information, the federal government needs this information for traceability and that type of stuff. The burden of the cost shouldn't fall probably on any one segment of the users. I think commercial competition to provide the best products is going to be one of the best answers for this too. And as I've already mentioned, there are a lot of companies that have been working on this for a number of years. The federal government, APHIS, is now, I think over a number of years, coming to realize that it has to be a teamwork. And John, I'm not picking on you. You probably have realized this all along, but I think that there have been some pretty great strides made fairly recently on getting this thing to kind of come together. One way of doing this is if the storage media, if companies in private enterprise are those that store this information, it may be more palatable to the veterinary profession and to the states and to the livestock industry if something is stored in a state-owned or state-used capability instead of federal. And again, I don't have a black helicopter. I don't have the mentality that the federal government's out to get all of us, but I can tell you, at least in Wyoming, and I'm sure in several states, the producers feel that they don't want any more to do with the federal government than they have to. So I would hope that it would be more palatable to them if it was with a state-owned but federally compliant. And then we have to have something that will work with other data collection systems. I think I've probably already talked about. So who are the players? I don't know that I need to list off all of these, and I'm certain that what I've listed under those commercial interests is not a comprehensive listing. I mean, there are other companies that I've talked to over the years and that have called me, but this is just an example of some, and many of them are already working together. Many of them are already talking with APHIS about getting this thing done. And I've got APHIS listed at the bottom of this list, and that's not, well, obviously it's intentional, we put it there. But I want to point out, that APHIS actually is a very key player in getting this entire thing integrated. And if we can't get it integrated from private industry through the states with APHIS to where the data can be shared and utilized as it's intended to be, then we've failed in the mission.